conversation. So, Scott, what was great is I was trying to remember how our paths crossed. And this morning, I got an email from one of your colleagues, Sharon Parver, who said, I'm so excited that Scott is on. I'm glad I made that introduction. So thank you, Sharon, for the introduction. And I've been looking forward to this for a few months, Scott. Before we dive into the data and information you're going to share with us about CAST and technology, tell us a little bit about your background and what led you to your current role there at LeadingAge.
Sure. Thanks, Steve, and thanks, Sharon, for making the connection. Yeah, I've been in aging services for the last 15 years. My background's in gerontology and in business, not technology related. However, when I was in graduate school, one of the things that was a focus point of my studies was how to leverage technology to enhance the aging experience. And I had an opportunity after graduate school to work for a very innovative nonprofit in New York City called Self-Help Community Services. And they had just changed their mission statement to include applying new technologies to address the challenges of aging. And I started off there being the director of client-centered technology. So this isn't technology that staff are using, but more of what are the residents using in senior center NORC programs or affordable housing. And I help implement passive monitoring systems that monitor IADLs and ADLs, brain fitness programs, telehealth kiosks. And I actually had a really interesting project that I helped launch in 2010. It's been a decade ago. It's crazy. Called the Self-Help Virtual Senior Center, which helped connect homebound older adults through group video chat, similar to what we're doing right now, to help socially isolated individuals that can't go to senior connect to do that from their home. And that's been one of my passions. But I found myself wanting to work at a more national level. So I was already familiar with LeadingAge and LeadingAge CAST and Majal, and the executive director, and liked the work, and reached out and been with them for the last 7 years and been loving it.
So I just wanted to stop you on one thing. So sure. You were doing some video conferencing. This was obviously over 7 years ago.
Yep.
With isolated older adults. So I'm curious your reflection on, and maybe you're going to talk about this, but now we're actually using this technology.
Yes.
I don't think anybody even in our audience remembered using this technology way back when. I'm sure you're sort of shaking your head at the adoption.
Yeah, and I'll be talking about that when I talk about some trends,
great.
What we've seen. But you hit the nail on the head. Like the amount of technology adoption since COVID has been astronomical, but it brought light to, like, you can do things to help people that are in their homes, and things could have happened before this to set them up, because you can do virtual programming everywhere. So I think people are realizing, wow, actually, if you have the infrastructure, the processes, and understand how it works, you can provide content and interactions virtually to people, because there's so many people that are at home that need that type of interaction.
Okay, great. Well, yeah. I'm gonna, I'll sit here and babble with you forever. So I'm gonna drop behind the curtain.
Sure.
And as I do, I want to just pass along a question that just came in from the audience that says, so what or who is LeadingAge? I think for those of us who are in the field, we're very familiar with the trade association LeadingAge, but some of the people in our audience might not be as familiar. So if at some point in your program, you can kind of give a little overview. There we go.
Sure, that was slide number one. Thanks for that question. Yeah, because I was going to level set, because sometimes people think CAST is separate, but it's not. It's part of LeadingAge overall. But LeadingAge is a nonprofit association that represents over 5,000 aging service providers. And we span the whole care continuum. We're not focused on one business line. So that could be from large life plan communities to skilled nursing communities, hospice, home care, senior centers, all the way down. And we just recently affiliated with the Visiting Nurse Association of America. So it does the whole care continuum, and we focus on advocacy, applied research, and education. And within LeadingAge, there are several different centers, like the Center for Workforce Solutions. And the center I work for is the Center for Aging Service Technologies, which is looking at helping aging service providers adopt technology, but also be thoughtful about how they're doing it. We don't want people to be adopting the newest cool widget. We want them to adopt something that they actually need. Talking about this a little bit later and how you should have some strategy behind what technology you're actually using. So we have members of our LeadingAge that work really specifically with us, and we also have a lot of business partners, technology vendors that work with us to help create content and partnerships to help support our work. And we also work with researchers as well. So that's kind of an overall high-level overview of LeadingAge and CAS. CAS has been around since 2002. The executive director, Maj Alwyn's been part of it the whole time. And I'm going to dive deep in a lot of the content that has been created to help aging service providers adopt technology and be thoughtful about it. I consider us technology evangelists where we're pushing technology overall, but we're not specific to a certain product. So I'm not going to be selling you, a certain solution. We don't sell solutions. We just provide information to aging service providers so they understand what solution might meet their needs based off of their overall strategy. But to set context, it's helpful to understand like what's already being used in aging services. And every year we partner with Zilgler, one of the largest financiers of senior living, to create the survey with the largest members called the LZ200. And we have a lot of technology adoption questions in there. So I just want to give the audience an kind of overall general idea of what technology has been adopted over the last 5 to 6 years. And you won't be surprised. So if you see here, this is data from 2013 all the way up to 2019. Electronic healthcare records have predominantly been adopted. 10 years ago, this would be a lot lower, but this is kind of driven by reimbursement. And the same for electronic point of care systems. So those adoption rates between 75 to 80% on both. And those are kind of something you see in most communities. Then if you look more at the safety technology, PERS devices are widely adopted as well. However, that technology, it's starting to innovate in terms of what solutions are available. The PERS, sorry for using acronyms, is the Personal Emergency Response System, the little pendant that you're used to seeing residents use. And unfortunately, half of residents that have these don't use them. So they're basically useless. And when I was working at Self-Help, I'd always reminding residents that that is there for a reason and you should be using it just in case something happens. And one of the things that we're starting to see in terms of safety devices, technology is starting to have automatic fall detectors. So that button that a resident might be wearing might have this automatic fall detecting technologies built into it already. And what we're also seeing is a lot of consumer devices having this technology built into them. The most recent Apple Watch 4 has fall detection technology built into it. So you're seeing a convergence of technology that's being developed for older adults and general consumer technologies having some of those features. And what I'm seeing is a lot of older adults prefer to have the more general audience technology, consumer-based technology that is just a feature. So you're seeing adoption of those types of technologies higher because they're consumer-based. Access control and water management systems, has primarily been leveled for the last 7 years, around 70 to 76%. That's going to go up in terms of, because of COVID, how people are managing people coming out of communities, and how that technology has been greatly adopted and enhanced, where not only is it access control, but you can add screening technologies into it, where it can ask you temperature, whether or not you've had a fever, and so forth. The other technology I want to just briefly give you an idea of, the case management software. Half the communities are using that. We started tracking social connectedness technology in 2018 when we launched that new tool. That's 50 to 61%. And I want to talk about that later in terms of COVID, how that has gone way up because of COVID, and just because of how many new products are out there and new ways to use it. And the other thing I'm going to talk about today is using data. And we started tracking data analytics. 10 years ago, we didn't have any data. Now we have too much data, but we don't know how to use it. And so there are tools out there where they'll take all the different disparate data systems, bring it together, and make sense out of it, so you can make smart business decisions on what you should be focusing on. In terms of telehealth has been low adoption, 20% for the last 60 years, similar with telemonitoring and behavior monitoring, very, very low. I'll get to this with the Philips research that they've done. That's gone way up just because of COVID and the Medicare flexibilities, where before physicians weren't getting reimbursed for this traditionally for Medicare unless you were living in a rural community and an originating site. And right now you can live anywhere and including your home and receive services. So that technology adoption for telehealth has gone way up, and I'll be talking about that briefly once I talk about the Philips study around COVID technology adoption. Another technology, physical exercise and rehab technologies, that's been pretty stable, 50 to 60%. There's some pretty cool technologies out there using home technologies out there that are using like Microsoft Connect devices, where you can learn a program for physical therapy and then practice at home using the Connect. And your physical therapy can see your progress through the Connect platform that they personalize for you. Medication management technologies is starting to go up slightly from 21% to doubled in the last 5 years. These are technologies that might help manage your technology or manage your medications in terms of dispensing, reminders. Some could be as simple as a clock that reminds you when you take your medications, or a device that might be more appropriate for someone that has cognitive impairments that requires the device to be locked and monitored. In terms of information exchange, like I talked about EHR adoption and how high it is, but the purpose of that technology is so not only can you digitally connect things, but share that information with other providers and partners. And unfortunately, interoperability is not completely there yet. So a lot of people aren't sharing information. They're just keeping it inside their organization. But we've been pushing providers to look at how you can directly share information with a hospital system, or connect to an HIE or HIE network where your information is being fed into the HIE, or you're subscribed to an HIE where you're receiving alerts if one of your residents is admitted to an ER. So we've been pushing aging service providers to not only adopt EHRs, but be thoughtful in terms of how they should approach sharing that information that they're collecting. This chart gives you an idea of single site campus providers, and it's similar to some of the data I showed you before. EHRs are in point of care are really high, and on the lower end are fall detection, telehealth, and resident social connections. The new category was 64%. It's higher now. I want to pause before I get into any of the other data around what's happened since COVID in technology adoption, to see if anyone has any questions. Steve, do you see any questions?
Yeah, actually, Gene asks, why was 2016 such a banner year, and why the fall off since? I'm not sure which slide that
2016. Let's see here. I'm looking at, oh, maybe it was the EHR.
EHR.
That's a good question. That year, a lot of the providers might have invested in EHRs compared to previous years.
Yeah,
it's not. I mean, it's only 4%. It's not
Yeah.
that. It just looks more significant because there's not a lot of variation.
But we've seen trends like that in like assisted living development and things of that nature. If there's a lot of investment going into a specific category, there's this buzz that could be out there, and I'm wondering if that might have been something that was happening around that time.
Possibly. And one of the things that we've been we're working on too is, the acute care got a lot of money to adopt EHRs through meaningful use. Long-term care was left out. So everyone that's doing this is not, there's no financial, incentive to do it like the acute care. So aging service providers sometimes get dinged, like, how come not, EHR adoption wasn't as high as it according to acute care, is because we didn't get that huge influx of money. And so that's one of the things that we're looking at, is advocating for potential incentive models from the government to help fund some of these EHR platforms, because this is the LZ 200. So these are the largest providers, aging or LeadingAge members. The smaller single sites don't have a lot of money to pay for this stuff. And if they need it to be able to share information. So
yeah, Robert has a pretty good question here. Do you view HIPAA as being perceived a barrier in technology?
HIPAA is a concern in technology for sure. It's popping up a lot now, specific to one technology category, that's social connectors and engagement technology, because of a lot of providers are starting to use voice assistants in their communities, and there's HIPAA considerations to think about, because some of communities, like a skilled nursing community, there might be health information exchange in the room. So you need to make sure that you're thoughtful about how that process. There are HIPAA compliant skills for voice assistants, and even if you're in independent living, you have to be thoughtful about just privacy concerns of how voice assistants are being used in general. But HIPAA's always been something that people are worried about. You just have to be thoughtful about that process. And later on, I'm going to be talking about some of the resources that we have around cybersecurity, and we touch on some of these HIPAA questions in some of our resources. And we partner with some organizations like Blue Orange Compliance that focus on HIPAA compliance and doing audits and those types of things to make sure that everything's on the up and up.
All right, well, I'll let you get back on track.
Sure.
And just, I will share that somebody is typed in that they attended a LeadingAge educational internet information session on estate planning, and it was very helpful, and a lot of good information was shared. So I'm glad that it's good to get this overview of all the great things that LeadingAge is.
Yes, we do a lot, and that's sometimes a problem, because we're doing so much. It's hard to get focus on some of the bigger things that we're doing. But I want to talk about interesting report now that we talked about the past, but what is the COVID effect on tech adoption? This is a study that Philips did. They interviewed about 250 senior living organizations last summer, from July 30th to August 15th, and they were talking about, let me move this so I can see it, technology adoption and how the effect of COVID on it. And the first question is, how did your organization adjust its COVID related technology spending? And you can see here, a lot of people increased their spending. Almost 80% of respondents noted that their organization increased spending on technology in the first half, because they had to, right? You had to do it for staff, you had to do it for residents. So that's not that surprising of a observation. But if you look at this question, in which of the following technology categories do you plan to increase your investment in 2020 and 2021 as a result of COVID? And if you look, the largest one is virtual activities engagement for residents, and virtual tours and telehealth and remote monitoring. So there's been a huge influx on virtual visits, in activities and telehealth, because people really couldn't connect with their residents without using those types of technologies. And a lot of organizations had to pivot, so they might have had a platform that was focused on technology application that was focused on group activities in the community room, but then they had to repurpose that technology to do individual one-on-one virtual check-ins with their doctor or with a family member using those same platforms. So the next thing I want to talk about, which of the following statements best describes your technology approach? So if you can see here, a lot of people generally understood what doing, but they didn't have a plan, which isn't surprising. But a lot of people had trouble with the internet connectivity requirements and the general infrastructure of their building. And that was a huge barrier. because they didn't really understand the technology needs of what they were doing, because you went from moderate bandwidth requirements to heavy usage all the time, because because of the social distancing requirements, were using, Netflix a lot more, Skype a lot more, FaceTime a lot more, and that had a huge impact on their infrastructure. What is the most pressing technology and telecommunication infrastructure challenge facing your organization that has hindered your ability to address the COVID-19 crisis? So number one is poor, as I talked about, poor infrastructure and poor Wi-Fi. So, both from infrastructure and the digital and the physical has caused a huge issue in terms of providing that type of support for individuals in the community. Have you experienced any of the following hurdles to implementation? And the number one, staff members are too busy. That's not surprising, considering how staffing was hard during COVID. Lack of training was a huge one. But one of the things that surprised me is that this first one, resident was resistance. They weren't. I think because people needed a way to connect with people, and technologies was primarily a reason to do it. So that the hesitancy that a resident's never used a tablet before went way down, because if they want to talk to their doctor, one of the only ways to do it was through video chat. If they want to talk to their family members, one of the only ways to do it was video chat. So that hesitancy was gone, and that's really increased the adoption of social connectedness technologies and telehealth technologies. And I call telehealth light because of the restrictions on telehealth and how you could use non-HIPAA compliant video chat like FaceTime to talk with the physician. It made it so much easier to talk to your doctor using those types of platforms where you don't have to log into a portal. I think at some point that's going to go back, where you're going to have to use a HIPAA compliant type of technology. But I hope that acute care is thoughtful about how you engage residents in those types of platforms, because it has to be super easy for them to use it and not overly complicated. Because I know a lot of physicians were frustrated because their patients weren't able to get on the platform that was more of a patient portal than a FaceTime visit. I want to stop briefly and see if anyone has any questions, Steve, around what we're seeing since COVID, before I jump into the technology tools and resources that we have.
I think the deck has been cleared on that first round of questions, but whenever I say something like that, a hand pops up, a question pops up, but okay, so let's just keep on going. But
Perfect.
that's a great reminder for the audience to just type in your questions. We can always come back to them.
Yep. So one of the things I want to talk about is, and I briefly mentioned this, is a lot of providers are adopting like the coolest technology or innovative thing that they read an article about, but you really need to be strategic about your approach. And so 5 years ago, we came up with the strategic IT planning tools for providers to think about how you should approach technology, but be strategic about it. And we came up with the strategic planning and strategic IT planning resource that helps you guide you through the project. So the first step of this is basically you have to have a strategic plan, and we walk through that planning process. But also, you take your strategic plan, you identify your main business objectives, and then you pull out those objectives and figure out, okay, which technology applications can help support all these different business objectives. And then once you identify those applications, you look at what infrastructure upgrades or things do you need to consider to support those. Because a lot of times providers were adopting technology, they might adopt an EHR that's web-based, software as a service, and they don't have the Wi-Fi infrastructure support. So if their staff goes all over the community, they can document anything they need to. And we're having issues with that. And this process helps you be more thoughtful about how to do it. And I'm going to show you on our website. So if you go to leadingage.org, all the resources that I'm talking about today are available on our website. There are some areas, some of our content is kind of behind a, not a firewall, but it'll ask you for contact information if you're not already a LeadingAge member. So if you go to Centers, Center for Aging Service Technologies, you can see here, scroll down here, the strategic planning tools. And this is the workbook that I talked about. And it's a very long workbook. It's about 60 pages, and some people don't want to read that long. So we actually created process flow charts that summarize each of these main sections. So you start here. Have you recently created a strategic plan? If you say yes, you go here. If you say no, this module takes you to a shortcut to how to do that. Does your strategic plan include a recent technology IT strategic plan? If you say no, this goes you through the process of upgrading your strategic plan, and so forth. So we try to create content for very detailed, like book, but also create flowcharts to make it a little bit more easier. And we also publish case studies. We published, I think, 6 or 7 case studies. These are providers that have gone through that process of strategic planning, and gives you example of their implementation approach and how they did it. So I encourage you to look at those types of resources. So that's like, so if you're on this call right now and you're like, I'm overwhelmed with all the technology out there, I don't know where to start. I always tell them, go to this resource, look at it. You need to be strategic about what you're doing. You shouldn't just do something because the vendor's pushing it. It should be tied to your overall business strategy and not something that's on the side. So that's a main thing I just want to stress to everyone, like, and this is one of the most popular resources that under CAST that people are using just as a fundamental thing that they should understand. So I wanted to touch on that. The other part of that, so after you go through that strategic planning process, when you get down to, okay, now now I'm ready to think about products. We created technology selection tools so providers don't have to go out, learn about new technologies, which vendor's doing what. We created these portfolios focusing on certain product categories that give you information about these technologies. And we have 9 tools. And since social connectedness and engagement technology has been pretty popular, I'm going to click on this one as an example. So each portfolio has 5 components. The first one is a white paper that basically gives you context of what is this? What is this technology? What is the definition? What are the different types of technologies? What are the different uses of the technologies? What are some of the potential payment methods to get reimbursed for these technologies? What are some important planning steps to consider in terms of when you adopt the technology? So that's all within this white paper. And as I said before, our white papers are pretty long. And to summarize that, we create this interactive guide that here's an example of a paywall kind of thing to access one of our guides. This is a summary of that white paper in a very easy to comprehend fashion. It basically summarizes this like executive summary of the white paper. So do you know the different types of social engagement technology? If you say no, it'll talk about the different types of social connect. And then next, have you considered the benefits of social connectedness? If you say yes, it'll skip over that. So this is a high level summary. If you have a busy executive that doesn't want to read everything, have you considered payment models? No, I haven't. It will list them out. And if you click here, it'll dive deeper into the white paper so you can learn more about that. So if you know someone who doesn't like to read, this is an easy way to kind of get a high level overview of that. And like as I mentioned, when you go to our tools, we also work with vendors. So every time we create a new tool, we work with a group of aging service providers and technology vendors to create a product matrix, which I'm going to pull up here, which asks vendors what business line do you sell to, right? All these different business lines. What type of technology is it? Do you do video chat, audio chat, email, life stories, blogs, activity calendars? Is it user to your peers, user family? And so that we create this huge matrix, and we work with the providers, like, what are the things that are important to you? Like, does it require a tablet or a laptop? And we send this out to all the vendors. You can see here there's about 40 or 50. And every year they update this information. Some vendors go away, some come back. And you can see here, so if you're interested in this product category, look at all the information you have about products without ever talking to any of these vendors specifically. So there's a lot of information that we update every year. So it could save you lots of time and energy figuring out who's doing what with just going to our website and looking at all the data that we've already collected. And people are concerned about HIPAA. We ask, which products are HIPAA compliant or high tech compliant. So there's all these different data points that we're collecting on every vendor. And what we do is we send it out. A vendor has about 4 weeks to fill it out. We get it back. We send out the whole matrix that you're seeing here to all the work group, and which includes providers that help vet the data. We don't do assessments of whether or not what they're saying is true, because we don't have time to go through and make sure everything's correct. But we have other vendors self check the data that's there, and the providers that use that technology also look at it. So there's a lot of information that's being collected in the matrix, but in general, we take that data and we make an online tool so a provider can answer 8 to 10 questions and get a short list of vendors that meet their needs. And I'll show you an example of that. So we take the data from the online or from the matrix, and it always reminds people to read the white paper so you understand this technology category first. And generally speaking, the first question is, what business line do you need this technology in? So I'm going to just do an example. Say that I am a skilled nursing community, and you can see there's 37 products that meet that criteria. I want to connect users to peers, 36 products. I want to do video chat, social network, 20. I'm also looking at doing life stories. I need it to be mobile, so I want it to be a tablet, and also on a smartphone, so 15 products. I want it to be single system. I need it to be touchscreen and voice control, down to 8 products. I need it to be helpful for dexterity, 5 products. I need vendor support for content development. And I'm not that concerned about support services or HIPAA, and I don't really care. I prefer it to be software as a service. And I click view products. And it lists all the products that meet those specific responses. And if they partner with a provider, we highlight case studies. If you see here at the bottom, there's a case study. And this is a use case where a customer had partnered with the vendor to highlight how this technology is actually being used in the real world. So in this case, this is Connect Living in Ginger Cove. And all the case studies have this general format where it talks about the project description, the modality, how it was implemented, the business model, how it's being paid for, and their approach and the outcomes. So we collect over, we have probably 80 case studies just under social connectedness of use cases of how these different technologies are being leveraged. So in general, that is kind of the structure of all the different tools that we have. We have the white paper, the interactive guide, the online tool, the matrix, and case studies. And so that's just for this one product category, social connectedness technology. If I go back, we have these same resources on all these different product categories: EHRs, telehealth, medication management, functional assessment, shared care planning, social connectedness, safety technology, health information exchange, and data analytics. So that's a lot of information that we're updating every year. So if you remember one thing from today, if you think about any of these technology categories, look at our tools just to save yourself some time and energy in terms of research, because it can help you a lot in that process. I want to pause, Steve, and see if anyone has any questions about the technology selection tools or about the process.
Yeah, and actually, while you were talking, I pulled up that spreadsheet, and I'm pleased to say we've probably featured 2 or 3 from the engagement spreadsheet in just the last few months. But Natalie, from another piece of technology that we featured called Stack Care, was wondering, how does a vendor get on the list so that they can be included in your technology charts?
Sure, that's a great question. You email me at, and it's on the last slide, scode@leadingage.org. And basically I would send you the instructions for completing it in a blank matrix. A lot of times, the first year we launched the tool, we send this to as many vendors that we know that are in this space. Some of them don't respond because they look at it and like, this is way too much information. I don't have time to do it. And I said, fine, that's up to you. And then we publish it and then come back to us like, why am I not listening? Like, because you ghosted my 5 emails. You didn't do the work. But if you are a vendor on this call and you fall into one of these 9 product categories, email me, I'll send you a blank template. But the biggest bang for your effort is if you complete the matrix, your product will be listed in the matrix, an online tool. But you really want to think about publishing a use case with a provider that as well, because if you participate, we'll publish a case study for you as participate. And this doesn't cost you anything. So you can get your product listed and a use case published for just providing us some information about your product and how you worked with providers. So that's an easy way to get some raised brand awareness. And we do this just because we want to push this field forward in terms of highlighting what's out there. So there are probably vendors on this call that might not know about this, but that's partly why I'm getting the word out. Is this is a good way to raise awareness of what your products are offering.
Great. And I'm going to drop your contact info into chat here,
Sure.
Even though you'll be able to do it later and you'll have it on a screen.
Yep.
Let's see. Okay. No, this is really cool. And
I also, if there's no more questions, I want to briefly go over some of the other resources that we have on our website.
Absolutely.
Because I mentioned a couple of them previously. So, and I'm not going to go back to my slide because it's better if you just see. So if you go back to the Center for Aging Service Technologies, one of the things I talked about earlier was cybersecurity resources, and people brought up HIPAA. And we have a similar white paper that talks about cybersecurity and what you should be thinking about it. And we have a benchmarking questionnaire where a provider can go through and answer yes/no questions to see how well they're doing in terms of their cybersecurity risk. And we publish case studies. And this is the article that I wanted to reference in terms of opportunities, risk with new smart voice technology in senior living, because we created a work group around this because so many members were struggling with this because family members were giving Alexas, communities were starting to provide this technology, and we want to provide some of a framework of what you should be doing to support that. So, this is a good resource for people on the call. I also wanted to focus on another resource that we published recently, and this is we were looking at this even before COVID, but this was Resident Technology Guide, and basically this is a lot of members even before COVID were struggling with the technology demands of residents. 5 years ago, when you walked into the community, a resident might just have a computer or laptop. Now they have a smart screen, smart watch, a tablet, multiple smartphones, and voice assistants. So like the amount of technology that residents have or new residents are bringing in are astronomical, and providers are struggling. So how do the expectation is when I move, especially in a more expensive life plan communities, that when a resident moves in, they're going to want bandwidth that works so they can stream their ultra HD content whenever they want. They want to be able to use the technology they use in their home. And if they don't, they're going to be upset about it. And they also want training on how to use those technologies. So the expectation of what the residents' needs are around technology are way higher than they used to be, which to me is a good thing. So what we did was we created, white paper to talk about different models to help support that. There are organizations out there that work with groups of volunteers and outsource that type of technology. I know, Older Adults Technology Services, also known as Senior Planet, which now is part of AARP, provides technology support. They have an 800 number. Cyber Seniors also has an 800 number for technology support training. They do virtual training things. But some communities are actually starting to hire staff, or their IT person part-time will do resident technology support and training. Some organizations are paying consultants that focus on this it's happening very locally. There's, in the DC metro area, there's TechMoxie. In other communities, there's like one or two organizations that pop up that are addressing this need. And there are organizations like Can Do Technology that are more national that are providing that outsource model. So this is a great resource if you're struggling with all the technology on your community. Look at the white paper and look at the different models to support that, and some of the case studies as well, because this is not going away, and people need to be thoughtful about how they provide that support and training, because it's almost like an amenity and something that you should be providing. One of the things that we're working on this year as well is, none of this works if you don't have a consistent broadband internet connection. And we're working this year on creating a resource around implementing broadband and Wi-Fi in more affordable housing buildings where it's a struggle, where that's not provided, and how to do that in a thoughtful way. Luckily, there are some programs now that are helping subsidize broadband connectivity for low-income individuals. The FCC recently launched the Emergency Broadband Benefit Program, which went into effect, I think it was in May, where low-income individuals can get up to $50 off their internet connection, and also $100 discount to buy a tablet. So if you want more information about that, I can put in the chat too. That's the FCC Emergency Broadband Benefit Program, and I think there's $3 billion, and it's either before the pandemic emergency ends or that money runs out. But I'm hoping some type of benefit goes forward, because there's so many individuals, regardless of age, that were left behind during COVID because they didn't have access to affordable broadband internet. I want to go back. Sorry, Steve.
Oh no, I wasn't aware of that program, so I'm really eager to learn more about that, and hopefully we can help spread the word about it. I really like your it's so long overdue, the support, technological support for residents. Years ago, I lived in 5 different senior living communities. Mm-hmm. And when I would do these temporary assignments, just because of my younger age than the residents, they would recruit me to help them with their computer problems. And I always reflected, what would it be like if you worked in an office and there was no technical support? If your boss just said, okay, just have at it and figure out how to do things. And I've really been pleased over the last couple of years to bump into a few communities that have technical support for the staff that's there and technical support for the residents. And it just makes sense, and it's long overdue.
Yeah, it's definitely something that is long overdue. And I mean, back when I was at Self-Help, I was that guy. Like I would, I was in an affordable housing building where I'd go, we had 7 buildings on the campus, and there were over 1,000 residents. And I would do troubleshooting stuff, because they would call the social worker and ask the social worker to come up and fix my smart TV. Yeah. And then I would help offset some of that, just because I knew my background, and it takes like a special person to be able to do it too, because not all IT staff can do resident support, because it's a different way of approaching a different patients. And because a lot of times, sometimes they might just be calling for help because they want someone to talk to, unfortunately. Mm-hmm. And that's what I've found with some of the consultants that have been providing support, is sometimes they call, half it's they have a problem, half it's they just want to chat about what's going on in their life. But yeah, it's been something that we're LeadingAge has an annual meeting coming up end of October in Atlanta, and one of the sessions that we're doing is specifically focusing on the different models. And we have providers that are highlighting these case studies, talking about their experience from a provider in Florida that's doing more of a single site approach, where they have their hired staff to do it. We have a provider that is more of a national provider, and their approach in terms of how they just have their staff do it. And then highlighting more of a national approach. We're having someone from Cyber Seniors talking about what they're doing on a more national level. So it's an ongoing thing that we're thinking about And we're continuing to think about, and we're pushing providers so that the norm is when you walk into community, you have the broadband access for residents, you have the technology support and training, and it's not an issue. So it's a smooth transition from your home setting into a community. And also for home care providers, like how do you do that remotely and what that looks like? That's another thing that we're considering too, is, a lot of people want to age in place, and if they do, like, not having that technology support is a huge issue, and it puts you at risk for social isolation.
Mm-hmm. No, this is great.
I also, we have all these different case studies that I looked at. Make sure you look at those. We did publish some other resources around COVID. There was a quick cast on social connections engagement technology, and basically how to repurpose what you might be already using during social distancing. Things are opening up, but this is still important to look at. And if someone's interested on the telehealth aspect and the Medicare flexibilities, we have a quick cast on that as well. And LeadingAge created a pandemic playbook, and there is a substantial section around a chapter around technology too. I just wanted to make sure everyone's aware of that as well, those resources that we have. And all this stuff is available on our website, leadingage.org. And I want everyone that has questions, the vendors on this call, that, if I'm very available in terms of answering questions. Any providers have, thoughts on something they're doing or projects, I'm happy to bounce ideas around. If you have any questions, I'm happy to help. So take down my information.
Great. And I just dropped it into chat one more time there. Man, once again, I look at the clock and I'm like, we're almost to the top of the hour. This was great, Scott. And one of the things that for our audience, because our audience has become much more diverse in the last year, I realized that, we started these discussions off and it was 100% providers. And now, you can see by some of the questions and comments that we have older adults and caregivers that are tuning into these. But one of the cool things about a lot of the technology that's featured on the LeadingAge site, I looked at it on the matrix, is that even though LeadingAge may be looking at this from a provider perspective, most of these options do also have a consumer perspective as well.
And it's great that you mentioned that. So what we started doing, I don't know if you saw this, but on the social connectedness engagement online tool, we had all the business lines. So we added a question for B2C. So if you're a business selling to an individual consumer, you could be listed there too, because caregivers were calling saying, I want a platform that's, because a lot of these systems don't sell to individuals, right? So we wanted to make that available. So this year we added that sense that if it's selling directly to consumer, to list that. So that's one of the things that if a provider's, they have residents, they're asking questions, that we can send them the tool and it's still applicable. You're right, we do focus on providers, but we're adding some of that content that's relevant to people at home as well.
Yeah, I just wanted to, quite honestly, I was just scheduling a discussion next month with a provider that is known primarily for serving the aging life care manager market. But when you go to their website, it says, are you here because you're trying to find a solution for your family, or are you here as a provider? And it's really easy for these folks to serve both audiences. If you've created the technology and you can give people access to the platform, it's fantastic. Gene asks, how much bandwidth do you recommend for seniors in a community?
It depends on how big the community is. If it's a smaller community, 50 residents, it's going to be about a lot lower than it's 300. And there's different formulas you can think about. So it varies greatly. I can't just give you an answer because it depends on not only how many residents you have, but the unique characteristics. So I would do a technology assessment, send a survey to all the residents saying, like, what do you have in your community? And actually, one of the things that I encourage you to do if you're opening up a new community and residents are coming in, have part of their intake form is like, what are they using in their room, in their apartment that's already technology related? So you have an idea of like what's in there. and what's the potential technology support and training needs. If every resident's moving in with 10 devices connected, I need to make sure I have the bandwidth and the staff to help support that. And if you know that as they're moving in, you're way better off than if you don't know that.
Yeah, he's Gene says they're shooting for 100
Megabits.
megabits, and that his residents don't know what they're using. So
yeah,
uh,
it's I always go big and have more than you need, because it grows. All the technology and the amount of people using it's just gonna get.
yeah, all of us have experienced what it's like when you don't have enough bandwidth.
Yes.
And so the goal is to avoid that. Let's see, Joan Green, who is a real technology advocate out there, and she tuned in late. She says, sorry if you already spoke about this, but how, oh, okay. She was asking about HIPAA with the echo dots and the echo shows. Yeah, Scott did address that, Joan, and I'll send you a recording on that, but I don't know if you've got any additional thoughts on.
No, look at there's an article under cybersecurity resources. It's the last bullet, and it specifically addresses those questions and gives you kind of a framework to think about whether, because there's multiple variables, like are you giving, as a community, are you giving out the devices, or is it a gift from a family member? Those are two different scenarios. Is it a HIPAA regulated community, like a skilled nursing community, or is it independent living? So that each scenario has different advice. So it gives you a framework to how to think about it. So I encourage you to look at that.
Yeah, and Gene, I always want to give Gene a gold star because he puts in so many good comments. But he's quoting Steve Jobs that it says, "Tell them what they need." And you know, in sort of closing out this discussion and seeing how much technology adoption has been used by our field this past year, it's really is one of those things, like that quote that Gene is saying, is that we've been telling this field to start using technology for years.
Yeah.
And talking about how much more efficient and how much more communication and this, that, and the other. And, you know, it's, on one hand, it's exciting that the pandemic forced us to use this. On the other hand, it's kind of sad that, you know, I know this dialogue has been going on for many years, and we've just chosen not to go down that path for budget, or thinking that our residents can't use it, or all these other excuses. And so it'll be really interesting to see what the future holds.
Yeah, I mean, one of the silver linings of this past year is that technology adoption, senior living in general, has gone way up to the point where it needs to be to help enhance the quality of life for older adults. And we're just happy that we had a lot of resources already developed. So when people needed that extra, we had a lot of that already created, because we've been talking about this for years.
Yeah.
So.
Well, I think it's past 1. We got through most of the questions. I'll read. This is interesting because we've had many discussions on voice technology, but Joan says that it's evolving with the new ability to automatically delete saved recordings if just the echo dot is being used. I finally got permission from a skilled care community when a patient wanted to use it. Yeah. I mean, you've really got to stay up to date and have somebody out there that is really keeping up to date with technology, especially when we're talking about voice tech.
Yeah.
And Joan, I had no idea about that. And that's something that regularly comes up on a conversation.
100%. Yeah.
So thanks for sharing that with us. Well, Scott, I want to thank you for joining us. You know, it's ironic that I've got you and Sharon from LeadingAge is on the call. You're one of the panel members. And as I was glancing at our agenda on Friday,
Linda.
We've got an affordable housing discussion, and we've got Linda who's going to be involved in that. So we're really
Linda's great. Yeah. I'm happy to be, I'm happy that we're engaged with your organization, Steve. Happy to be
All right.
here.
Well, thank you, everybody. We've got this recording and we'll be following up with you, and stay in touch, Scott, and let us
Yep.
know what's going on. All righty.
Thank you.